Hello, everyone. My name is Andrew Schwartz. I'm one of the current pharmacy residents at Orlando Regional Medical Center and a former USF Bull from the College of Pharmacy. And I'm so excited to talk to you guys today a little bit about effective patient counseling, how to get the most out of your counseling sessions, not only during school, but also going forward at your different practice sites later on. So throughout this presentation, I hope to give you guys a couple of tips and tricks that I've gained along the way to make your patient counseling sessions not only better, but to make you more comfortable when you have to go out and talk to patients. So through this presentation, I hope you're able to identify the major components of an effective patient counseling session, be able to examine the benefits of utilizing open-ended questions when you're talking to patients, and overall the goal is for you to be able to conduct an independent patient counseling session out in practice. If you haven't done so already, I really encourage all of you to take a moment to look over the APHA patient counseling rubric. This is a rubric that they utilize in their patient counseling session competition, but I know formally we used to utilize it at the college as the scoring rubric for our patient counseling sessions. It goes over the major components of a patient counseling session, which we'll break down during the course of this presentation. And I think it's a really good resource just as a refresher before you have to go do any patient counseling to know what you really should be discussing during that session. It might seem really self-explanatory, but make sure at the beginning of every patient encounter, you take the time to introduce yourself. I can't tell you how many times I've seen students go to do a patient counseling session and forget to tell the patient who they are, leaving the patient really confused who's talking to them and what the purpose of the encounter is. And as a student, make sure that you do utilize your title as a pharmacy student or better yet, as a pharmacy intern. This will help build trust from the patient that you are a medication expert and you really do know what you're talking about. But don't go into any patient counseling session assuming that the patient knows what the conversation is for. Make sure that you establish that you want to talk to the patient about their medication to get the most effective use of it, as well as to discuss some safety concerns. So for instance, if I was going into a patient room, I might go, "Hello, my name is Andrew. I'm one of the pharmacists here at the hospital, and I just wanted to take a couple of minutes before your discharge to go over your medications, make sure you understand why you're taking them, and to make sure that we get the most effective and safe use of your medications leave. Is now an okay time to talk about your medications?" In a couple of seconds, I've introduced myself, why we're having this conversation, and really getting the patient to buy into the counseling session overall. This step goes hand in hand with the last step of introducing yourself, but make sure that you definitely take the time to confirm the actual patient you're speaking to. In the community setting, you can have the patient verify their date of birth or maybe even an address that's on the account to make sure the patient that you pulled the medication for from the shelf is the person you're actually speaking to. In the hospital setting, this might be a little bit more difficult, but you can certainly always have the patient still verify their date of birth to make sure you're speaking to the right person. Don't assume that just because you went to the right room that you're actually speaking to who you think you are. Patients move rooms all the time in the inpatient setting, and sometimes the electronic medical record isn't as up to date as you think it might be. So definitely take that time still to confirm who you're speaking to. With this also, don't forget to address the right people in your counseling session. And I address this a lot with pediatric patients. A lot of times in our patient counseling sessions, we're talking directly to the person who will be taking the drug, but with our pediatric patients, we might be speaking to a parent or some guardian who will be administering the drug to their pediatric patient. And so you want to make sure you reframe how you give instructions and make sure you confirm the understanding in a different way as well. Something to keep in the back of your mind during these counseling sessions. Now we really get to the meat of the patient counseling session. Before you start discussing the new medication that the patient has brought a prescription for or that you've been assigned to go talk to them about, it's always a great idea to get as much background information on the patient as you can. And I love using the acronym MAC. It stands for medications, allergies, and conditions. If you remember these three things, you'll never go wrong. With medications, definitely make sure to ask them about any prescription medications they're currently taking, any over-the-counter medications that they have taken or are currently taking, and any herbals, vitamins, or supplements that they're taking. Sometimes with all three of these, you might need to do a little bit of prompting of the patient because sometimes they forget or they don't think, especially over-the-counter medications, are actual medications. So if you have any inkling that they might be taking something that they haven't said, definitely do a little bit more digging and prompting of them. When it comes to medication allergies, you always want to make sure that you document this as best as you can. You want to find out what the allergy was, what medication it occurred to, for instance, what actually occurred, and when the allergy occurred. So, for instance, if someone tells you that they took an antibiotic but they had an upset stomach, well, that's not really an allergy as much as it is an intolerance. So, it's good to still document, but might not change your therapy. Versus if somebody tells you that they took the same antibiotic but got hives and their throat closed up like anaphylaxis, well, that might change what medications we utilize for them in the future. And then when discussing current conditions with them, you want to find out if it's an acute condition, and that might be the reason that they're taking this new medication, or if they have chronic issues like diabetes or hypertension. If they tell you that they have an acute or a chronic disease state and they haven't told you about a medication that sounds like it would go with that, that's when I would go back to step one here and talk to them a little bit more about medications that they might be taking, because they might have just forgotten that they were taking it, or they've been on and off a medication for a while. This could be a good indicator of compliance and adherence to medications, which you might need to address later on in the counseling session as well. So, real quick, 3 questions, but a lot of useful information you can get from just these 3. Above all, our job as pharmacists is to explain the medications to the patient as best as we can. Remember that you don't have to get all wrapped up in the technicals with things like the mechanism of action or the pharmacokinetics of the drug, but definitely giving some insight to the patient as to what the drug is used to treat and what type of medication it is are going to be really impactful for them. Always, always, always remember to give the brand and generic name too, as the patient might be familiar with one of the names, but not the one that you utilize. For instance, if I was counseling a patient on warfarin, I would describe warfarin or Coumadin as a blood thinner as the class of medication to give the patients a better understanding of not only medication, but what we're going to be utilizing it for. This is also a great opportunity to utilize open-ended questions to start the conversation and ask the patient what they know about the medication and especially about the disease state to get a better understanding of how much teaching you're going to have to do during the course of the counseling session. I always try to give an overview of how the medication will help them with whatever disease state they have, so that they understand more of the importance of why they're taking it. For instance, I might explain that the patient has high blood pressure and the doctor has prescribed them lisinopril, a medication to help bring down their blood pressure so that they can correlate the disease and the medication a little bit better. Getting a sense of how much your patient knows at baseline will help you determine not only how much you have to teach, but at what level you should be teaching it. But that goes into our next point of don't be too technical. Remember that when it comes to health literacy, if you keep your vocabulary at an 8th grade level, you should always be okay. Try and avoid big medical jargon like hypertension or deep vein thrombosis, instead breaking it down for the patient to understand terms that they'll be familiar with, like high blood pressure or blood clots in the legs. Again, this will keep them more engaged in the conversation and build more trust between the patient and you. After you take the time to describe the medication, you're going to have to go into detail of the way the medication should be taken. Again, don't be afraid to lay out in very clear, basic terms what the dose of the medication is, how often the patient should take it, and what route to take it. You don't want a suppository to accidentally be given orally. This is also a great time to incorporate device technique education to your counseling sessions, showing the patient how to give themselves injections or inhalers as needed. If time permits, you can always consider writing out a medication chart for your patients to describe exactly when to take medications and how much of each medication they should be taking. And I find this most helpful with our geriatric patients or patients who are taking multiple medications timed throughout the day. But again, this is only going to be if time permits or if you really, really think it's going to be super beneficial for you. When you are describing the regimens that the patient should be taking, don't leave any room for ambiguity. Any dosing measurements that can be misconstrued should be clearly laid out. And I find this occurs most often with our liquid medication formulations. So make sure that the patient only utilizes provided measuring spoons or cups that come from the provider. And you can see here one of the most common examples of this is telling a patient to take 1 teaspoon when really a teaspoon that comes medically versus a teaspoon that we just find in our kitchen drawers is very different than the 5 milliliters we actually mean. Another thing to highlight here is is specifically for as needed medications, making sure to go over the indications and what signs and symptoms the patient should be looking out for to indicate that a dose of the medication should or should not be given. For these medications, we want to make sure that the patient can take them when they need them, but to make sure that they're overutilizing them if they don't need them as well. So making sure to have that conversation with them and really laying out when they can or can't be taking medications throughout the day. One of the key things to describe in patient counseling sessions also is common side effects the patient needs to be cautious of when starting a new medication. Sure, warfarin has listed on it that it can cause chills, but is that really something we're going to spend a lot of time on discussing with a patient? Much of your understanding of which adverse events to look out for and to discuss with patients will come from your clinical experience and your pharmacotherapy courses. But you can always utilize the package insert of a medication or your online databases like LexiComp and Micromedics for more information. And I especially encourage you to look at the patient education sections to find the most pertinent information to relay during your counseling sessions. But when you are discussing side effects or adverse reactions that might occur, don't forget to have a plan in place for if one of those do happen to your patients. I highly recommend developing a mindset for moderate versus severe events and what to do for each situation. For instance, if a patient is newly started on a blood thinner, I might tell them that minor bruising after bumping into a table is normal, but seeing blood after using the bathroom or throwing up what looks like coffee grinds is an indicator of a more serious internal bleed, and they need to be seen by a doctor or in the hospital immediately. Remember when you are discussing side effects that they can be very scary for patients, but to reassure them that you're not telling them this to scare them or to intimidate them to not take the medication, but rather to know what to look out for to monitor while on the medication so that they can be the most safe when they leave the hospital or leave your pharmacy. Drug interactions are another big area we can give a lot of education to patients. This can be for both current and future drug interactions they might experience. Don't forget that certain medications have dietary interactions as well, so make sure to discuss those with your patients. I always like to give a blanket statement on medications I know have significant interactions, such as blood thinners or a lot of our antifungal agents, that the patient should talk to their doctor or pharmacist before starting any new medications, both over the counter and prescription, just to make sure that there's going to be no new interactions they need to be worried about. Here is one of the biggest areas to utilize the patient chart to your advantage. In practice cases, particularly in class, they may give you a home medication that has a drug interaction with the new medication just to test the way you think. But for certain, you're definitely going to see this a lot out in real practice. You'll have to decide the level of risk of the interacting medications and weigh the risk benefit ratio to giving the new medication with an old interacting one, or deciding on whether a new therapy option should be initiated. A lot of your clinical decision making will come with time and practice, but you can always utilize your online databases to run drug interaction reports as well for more guidance on how to change therapy and decide if a further conversation needs to be had with the patient or with the prescribing physician as to how to address the drug interaction that may or may not occur. It's inevitable that patients are bound to miss doses of their medication, especially for chronic disease states, so it's important to tell them what to do if they do happen to miss any dosages. Many times, unfortunately, the only guidance we get from package inserts is for the patient to take the medication as soon as they remember, unless it is close to the time of the next dose, in which case they recommend skipping the dose and just taking the next one. Now, there are certain medication classes where missed dose recommendations are different, and I highly encourage you to look it up for each medication. Particularly, one that comes to mind is our oral contraceptives. Do have very specific recommendations of what to do when you do miss a dose. Unfortunately, for most medications, though, this doesn't give us much clear information, and our decision of whether to give a dose or move on to the next dose will be highly dependent on the specific medication and what we're utilizing it to treat. But the general rule of thumb is if there is greater than half the time of the dosing interval until the next dose. So, for instance, if the dosing interval is 12 hours and there's more than 6 hours until the next dose is due, it should be safe to give those medications. This is also a great time when discussing missing doses to talk to the patient about how they remember to take their medications at home to assess their level of adherence. Even for our most adherent patients, I'll still have a quick conversation with them about what reminder aids they utilize and what might work best for the individual patient. Nowadays, there's a lot of great apps on phones to track what taking medications and also to send reminders to patients that their next medication dose is due. However, you might find with your older patients that they like to be old school and keep a weekly pill box and a calendar that they can mark off. Whatever works for the individual, though, just make sure to encourage them to utilize it as a way to reduce the number of missed doses they have overall. Another thing to remember to discuss with patients is the proper storage for their medications. Again, the package insert and online databases typically give really good recommendations of the conditions that medications need to be stored in. It's important to discuss with your patients things like the temperature it should be stored at, if it needs to be protected from light or moisture, and even if it can be removed from its original container or not. One big thing I like to always remind people, especially in Florida and especially during the summertime, is to avoid leaving medications in their car. Our cars heat up real quickly in the summertime, and patients might leave their medications in a cup holder, or ladies might leave medications in their purses, and we don't always know how temperature will affect that. So, just making sure that they're aware of that when they leave your pharmacy or the hospital. One thing not to forget is to discuss safety considerations when storing medications. There's a lot of pets in this area, a lot of children that we want to protect from harm from being able to get into medications. I also list theft here, it's particularly for our narcotics, to remind patients not to make themselves an easy target for medications to be stolen from them and put themselves at a liability of having medications that are in their name end up in the wrong hands. So, again, just a real quick tip could just be one sentence that you throw into your patient counseling session, but things that not only will you be graded on to be looked at, but definitely important reminders to talk to your patients about as well. Last but not least, at the end of the counseling session, make sure to advise the patient how many refills they have on each prescription. You may also use this time to reiterate how long the current prescription should last for the patient. For instance, if it should last them 30 days versus 3 months or even longer. Since I work primarily inpatient, we don't typically discuss refills for patients staying on the floor in the hospital. So instead, I might take this opportunity to reiterate during the counseling session for medications that are as needed indications, how often the patient could be asking for it, and how often they should be expecting to receive their medications overall. Again, this is a great time, especially for medication devices, to point out to patients where to look for how much medication is left in their device. I always like to think of here albuterol inhalers that a lot of times have a window countdown on them to show how many puffs are left in the canister. This is a great way to remind patients to look out for how much medication they have left and really what numbers they should be looking at for when they should call the pharmacy for a refill to be done for them. At the end of your patient counseling session, you should allow time for your patient to ask you any remaining questions they have about their disease state or the medication. This is a great time to utilize your open-ended questions to get more information out of your patients. In fact, I actually strongly encourage utilizing open-ended questions throughout the patient counseling session to assess the patient's understanding during key points, but particularly here at the end. Open-ended questions allow you to get more information from the patient than could be obtained from a closed-ended question because it allows the patient to provide more information and allows them to elaborate on the answers that they want to provide to you. For instance, saying, "Do you have any questions for me?" will more often than not get the patient to answer no. However, reshaping the question to, "What questions do you have for me?" makes the patient take more time and take a second thought about what they don't understand about what they've just heard, and really think about if there's anything that they're still questioning. One thing I also like to ask my patients, especially for new medications for a new diagnosis, is how are you handling all the information we just covered about your disease state and your new medication? It might take some time for you to become comfortable asking this question, but I feel that it gives insight into the emotions a patient is having with their medical management and to assess if there's any other resources you can provide to them to help them overall with their disease state. Asking a few open ended questions at the end and allowing the patient to ask questions overall is a great quick segue to start wrapping up the conversation to get them out the door. Though last, one of the most important parts of the counseling session is utilizing the teach-back method to have the patient describe in detail key points you discussed during the counseling session. Leading into the teach-back portion can be difficult, so I like to frame it in a way to put the pressure on me rather than making the patient feel as though I'm putting them on the spot and grilling their ability to pay attention. Typically, I'll frame it in a way to say, just to make sure I covered all the important points and didn't leave anything out, do you mind telling me how you plan to take this medication when you're at home? That puts the emphasis back on you as the pharmacist, but still allows you to get the information out of the patient that you need. In Teachback, it's really important that you pay close attention to what the patient is saying and to make immediate interventions if they do say something wrong so that they know how to safely take the medication at home. Definitely make sure to cover why the patient is taking the medication, how they'll be taking the medication, particularly if it's a special device that's involved in the medication administration, what adverse events to look out for, what to do if a dose is missed, and finally, how the patient plans to store the medication at home. Listen to see if there's going to be any barriers to adherence during this time and to see if there's any interventions you can make prior to them leaving to make them more successful taking the medication when they do finally get home. Do make sure at the end of your conversation to recap any major take-home points you definitely want to reiterate to the patient. It's been shown that patients are most likely to remember the last key things you say rather than all the information that you give them during the time of the counseling session. It's also really important during this time not to forget to give them any contact information you might have, just in case they do have any questions when they get home. A lot of times if you're inpatient or even in the retail pharmacy, you might have a business card, your information might be on the pharmacy bag, etc. Just make sure that there is something so that they can get in contact with you if they really need to. And that's pretty much it when it comes to patient counseling interactions. I hope you were able to learn a few helpful tricks from my experiences that you'll be able to incorporate into your own encounters in the future. Remember that it's a lot of information in a short amount of time to relate to a patient. So going in with a solid plan and this mental checklist of steps will be very beneficial to you. However, also remember that every patient interaction is going to be unique, so understanding flexibility and adaptability will be key in going forward with these sessions. Again, I hope you found some of this information helpful, and if you do have any further questions, please feel free to reach out to me. I wish you all the best in your next patient counseling sessions.